Hey, chapter 11 is a monster chapter. Every voluntary muscle in the body. There's actually 2 sets of files that go with it. These first videos go with part 1. I like included in this career path the idea that whether it's a physical therapist, chiropractor, athletic trainer, whatever type of medicine or treatment where you're dealing with people's muscles, it's not only learning about treating the actual disorder and helping people move better, but it's the idea that there's going to be a treatment plan developed, right? There's nothing that one treatment's not going to fix whatever's going on with this person's wrist. They're probably going to need physical therapy or some kind of therapy for at least a few weeks. In the last module, we studied bones, and we learned the axial skeleton, or things that are in the midline, like your vertebrae and the ribs and the bones of the skull. We also have an appendicular skeleton, our appendages, or things like our arms and legs and how they attach to the axial skeleton. So those same terms, now we can apply them to muscles. If I'm an axial muscle, I start and stop. Those areas are called origin and insertion of the muscle, and those are all on the axial skeleton. In other words, they're on my midline. But if I go out to my arms and legs, then I'm an appendicular muscle, and my origin and attachment is going to be on a limb. Axial muscles help me to do things like breathe and chew and swallow. And we'll see in this video some muscles of facial expression. It's my axial muscles that make me smile or look surprised versus appendicular muscles, they move me, right? It's the muscles in my legs that I use walking up and down the stairs, or the muscles in my arm that even driving a car where I'm holding the steering wheel. As a general rule, if I'm in the front, I flex something. We'll go through all of these in the chapter, but just making guesses. If I'm right here, what could I flex? The shoulder. If I'm here, I could flex what? The shoulder and the elbow. If I'm down here, I could flex the wrist. If I'm in here, I could flex the trunk or the spine. If I'm in here, I could flex the hip or flex the knee. Sometimes they're going to do a couple of things, like maybe they flex and rotate something, but a good rule, flexors are in the front and extensors are in the back. The ones in the back here would extend my head, making me look up. Here I'm going to extend the shoulder. Here I would extend the elbow. Extensors in the back, flexors in the front. Another key thing about these pictures is they're set up the same way that our lab models are set up. One side is a deeper view, the other side is more superficial. If I see bones, I'm seeing deep structures. Like over here, I don't see really the ribs, and this would be my pectoralis major, the big muscle on the front of the chest. And if we remove that, then I can see this smaller pectoralis minor, the one that's underneath it. Another way I could tell is right in here. This is some connective tissue, and that's much more superficial or on top of the muscles that are deep to it. The same thing in the legs. Notice this superficial view, and here we're seeing where they've actually cut off this superficial muscle so we could see underneath it. A little easier to tell here. This side is deep. I'm actually seeing the scapula. This side is more superficial. Here I see this big muscle, the trapezius. People call them the trap. And here I've had the trapezius removed, so I can see all of these much smaller muscles that are deep to it or underneath it. In this book, like most books, muscles are grouped according to their location, right? All the muscles of the shoulder are put together in one section of the chapter. Other things we'll see about each muscle are all of their actions. What's everything it can do? What are their attachments, right? We've seen those words, origin, insertion. And then a new word is innervation. Innervation relates to the nerve that tells that muscle to do work. At the end of voluntary muscles, we have tendons. Remember, tendons connect muscle to bone. Ligaments connect bone to bone. But here we're talking about muscles and the tendon that attaches it to a bone. Sometimes those tendons are very cord-like, like a little rope. And sometimes they kind of flatten out. A term for where they may kind of flatten out and merge together, they don't have a rope shape, is aponeurosis. Terms that were used when I was a student were origin and insertion, and even while talking, I'll still use those. I do like the newer terms though, the superior attachment and an inferior attachment. We'll see how this kind of fits in just a moment. But we would use the words superior and inferior if I'm on the axial skeleton. Remember, this is chapter 1 stuff. Once we got to the limb, we can't say superior and inferior. We're going to use the words proximal and distal attachment. The reason I like these terms better than origin insertion is the old way of thinking was that the origin was the part that didn't move and the insertion was the part that did move. But in reality, most muscles can have some movement at both ends. And so that's why they'll talk about having a distal attachment that's more movable and a proximal attachment that's more stable. Here I see a patient's right bicep brachii. Remember, it's the patient's right, not my right or your right. They're showing us that the relaxed muscle would be about this wide, and if they contracted this muscle, it would about double in size and become this wide. How do I contract the muscle? I move it. I bring the distal end toward the proximal end. To use older terms, here's the origin of the muscle, and here's the insertion of the muscle. But what we're seeing is it starts at one place and it ends at another place. When this muscle contracts, it brings the far end toward the close end. It's so overwhelming when we first start to learn muscles, but a lot of times there'll be hints in the name. Here we will see how the different arrangements of the fascicles, remember that's the like parts inside the muscle, they can help arrange things and then it'll influence the name of the muscle. Like sometimes there's a circular muscle. That could be like the sphincter that closes off while you're trying to run to the bathroom and then opens up once you're in an appropriate place. But what they're showing in here is the other end of the digestive tract. Here's the orbiculus oris. It's shaped like an orbit, right? It's going around the mouth. Oris is for the oral cavity. Just to stay here, we'll go back to our text. All of these fibers are running parallel to each other, and straight up and down is rectus. If I'm going straight up and down the abdomen, I'm rectus abdominis. If I'm going straight up and down the femur, I'm rectus femoris. Sometimes muscles are named because they merge, and when they're merging, this is called a convergent structure. And then some muscles are named by pinnats. Pinnats we could think of as like an anchor point. If I have one, I'm a unipennate. If I have two of these, I'm a bipennate, like that rectus femoris I mentioned. And then if I have a bunch of these, I go with multi-pennate. Here's the way I think of these three things. Maybe you've played tetherball, right? You played that game where there's a ball on a rope and that other end of the rope was attached to a pole. And this ball could go in lots of different directions. It has one anchor point. So tetherball is an example of a unipennate muscle, just like the extensor digitorum. Hey, what do you think the extensor digitorum does? Did you go with the extended digit? Hey, right on. My example of a bipennate, remember bi means two. And so I think about a flag that's on a pole. And usually that flag has two anchor points. This flag can still do a lot of movement, but it has less movement than this unipennate structure here. And my example of a multi-pennate is like maybe you had a poster when you were a kid and you loved this band or actor or somebody like that. So you took this poster and you put it on your wall and you put a bunch of tape on it. All of these would be another pennate, another anchor point. So multi-pennate muscles probably don't have as much individual range of motion, but they're more stable. Unipennate muscles maybe do have a little bit more movement to them. A couple of other things that are on this slide, covered in these chapters, but just flashcard idea. You strain your muscle versus sprain joint. Like maybe you've heard somebody playing basketball and roll their ankle. If they roll their ankle, they have a sprain injury. If they lift something heavy and it hurts their bicep brachii, then they have a strain muscle injury. Last thing on here is my drawing of Homer Simpson. We'll see in this video a muscle called the epicranius. Epi means upon, and cranius is cranium. And this muscle literally wraps all the way around the top of the head. But when we see it, we're going to see a frontal view and a posterior view. And here I'm just trying to plant the seed that later on we're going to see the epicranius, and it's literally one muscle that wraps all the way around from basically your forehead to the base of your skull. A key idea is that, especially voluntary skeletal muscle, there's lots of blood supply. And that's why some, not all, but some medications are given intramuscular. Intra means inside a muscle. The Glute Max is the classic one, right? You've seen it in movies where they're like, drop your drawers and get ready. Woo! All right. And they're going into the gluteus maximus. Thick muscle, there's way above the nerve supply in here, so there's really not much danger of negative side effects from the injection here. And then whatever we inject into this muscle is going to be absorbed into the bloodstream. We were looking at that rectus abdominis with the fibers running parallel to each other. We also saw the convergent muscle with everything going toward that shoulder. While we're learning this, we could just tie in that muscles go with tendons. But as we get into this, we're going to understand that because muscles have this complex arrangement, things are on top of one another, or maybe have to wrap around certain things. It's not always a pure tendon. We saw that other word, aponeurosis, and a raphe is another time when the tendon kind of changes shape a little bit. We saw our three pinnate muscles. My unipinnate was this extensor digitorum. My bipinnate is the most common type, and it kind of has the benefit of both of these, right? It's kind of a hybrid of the two. Versus the multipinnate, we saw that deltoid, and it gives up some of its range of motion for more stability. Definitions to get about the actions, the things that skeletal muscles do. The agonist is the star of the show. Another name for agonist is prime mover. They're the one that's doing the work. Everybody's got a hater, right? So for every agonist, there's always an antagonist. Antagonists are the muscles that do the opposite of what we're trying to do. First, just catch our definitions, and then we'll see it in several pictures, and it'll make sense. A third type of muscle are synergists, and synergists are helpers. Synergists assist. Sometimes they either get the movement started, or sometimes they stabilize while another muscle is doing a hard part of the work. When I bend my elbow, there's two muscles that work together, the bicep brachii, the big star of the show, and the brachialis muscle, who's actually the agonist here, but they work together, so we could say these two muscles are synergists. But I think of those words in other ways. Who's the agonist of Gotham City, right? Who's the star of the show? Batman. Who's Batman's synergist, right? Who helps Batman? Well, in some of the older stuff, it was Robin, but sometimes it's Catwoman, right? Alfred's the synergist. Who's Batman's antagonist? Who does the opposite? All of those other characters, right? The Penguin, the Riddler, and all of that. All right, we get it. Let's keep going. So with so many different muscles, there has to be a system to help us name them. Sometimes the name of the muscle includes the action. These are going to be things like a flexor something, or an extensor something, or a pronator, or a supinator muscle. And oftentimes there's even another hint, a flexor digitorum longus. We know in chapter 1, our digits are our fingers and toes. What's it going to do to our finger and toe? It's going to flex it. Where is this? A long way away. That also implies there's probably a flexor digitorum brevis, right? Let the names help you. It sometimes has an action. Sometimes it has a region, like rectus femoris. Femoris because this muscle is in the femur. Tibialis anterior. Dude, what do you call the muscle on the front of the tibia? Dude, that's the tibialis anterior. Dude, what do you call the one on the back? Dude, that's the tibialis posterior, right? It's named for where it is. Also, we could see like superficial and deep, or another word we learned in chapter 1 for deep is profund. Ooh, how cool is that, right? Sometimes we may have an internal and external version of a same muscle. Some muscles are named for what they attach to. Like we're going to learn about this muscle called sternocleidomastoid. It attaches to my sternum. And cleido is for clavicle, and that mastoid process, right? There is the three bony attachments in the name. We saw muscles like rectus often meant straight up. Other muscles run at an angle, and so they maybe have the name oblique. We've already seen an orbicularis. Remember, that was the orbit. We saw orbicularis oris. Other shapes are involved in naming, like the deltoid. Delta is for triangle. Rhomboid, which is a four-sided area. The trapezius, like a trapezoid. And then again, I mentioned this one earlier, but the shape could be long and short, or long and brevis. Sometimes there's multiple muscles, but one's just bigger, and the bigger one could be called magnus, or sometimes it's just major, and a smaller muscle could be minor. When we look into the glute area, there's gluteus minimus, gluteus maximus, all these in the same area. It's just, they're just named from small to large or large to small. A confusing part about this, though, it's not named for where they are on the body. We're going to see two muscles called rhomboid major and rhomboid minor. And everybody wants to put the major in a certain area, but it's just the bigger one. All right, Let's keep going. Some muscles are named by how many parts they have, how many heads, right? What's another word for head? Cep. Remember cephalic? What do I call a muscle with 3 heads? Oh, that's tricep. What do I call a muscle with 3 heads in my upper arm? Tricep brachii. What do I call a muscle with 4 heads? Quadricep. What do I call a muscle with 2 heads? Bicep. I copied this table into our notes as well. All right, see you in the next video.